Hello again. It is always a pleasure to talk to you all. And you feed me with all these great responses here. I really appreciate it. I apologize if I can't get these out in a real timely manner, but I'm still seeing people, so I'm overwhelmed with that. And I like to have a little R&R time, kick my feet back a little bit if I can, but it's been kind of hard here in the last few years. But I want to try to catch up today, and that way we're all caught up, and then next week we can start fresh here and some new things. I apologize that we're slow to get these videos on. I think he's about 4 videos behind right now, and we're just slamming in here, and it's we're in a small little place, and so bear with us, and we'll get it up as quick as we can here. So I apologize for that. These guys just can't keep up with an old guy like me. But let me go through here and cover some of your things, because I really want to make sure that you all, and from what the feedback I'm getting from some of your questions and answers, you guys are really getting it, and I'm happy to see that. Who was that? I had, wearing the robe guy. Oh, what was your name, man? Really wearing the robe. I mean, you got to take things on, I had a lady in yesterday, and she's trying to follow 4 or 5 practitioners at the same time, and they all differ, and she just doesn't want to get up and do the high-level detox that it takes. And that's just, you're not going anywhere. And you're going to always hear that from me, because I've sat here with lots and lots of people through lots of years, and there's only one way I see that it can be done. I see a lot of people trying all kinds of things. I think most of you realize that, people just try just about everything that's out there. Matter of fact, that brings me to one here that her naturopath told her that she was highly deficient in all these nutrients, and he loaded her down and gave her some intravenous, that scares me, slingshot mega nutrients, and I always thought, I'll come over here, it is, I think it is, and one of them, I'll find it, but that was the thinking way back in the Dark Ages. There's a lot of things, and I think if you'll read my books, you'll find that there's 4 processes that's essential to well-being, and it's just all common sense. The first process to nutrition, obviously, is to consume it. Obviously, you have to change your diet. But with that said, even the South American diet, there's some goodies there. So the first thing one has to do to be well is to digest his foods down. And we've been talking in our videos about eating simpler foods. That way it doesn't tax your body on breaking things down. And remember, we also talked about, if you look at the rest of the vertebrates on the planet, they're generally mono-eaters, particularly at one meal, but they don't roam too much out of their repertoire. I think a grizzly bear has 65% sage grass. He's got about 13 to 17% fruits, berries, and tubers and things, and then he's got about 7% meat, depending upon the age of the bear and that. And that was from National Geographic. I think when you get in primates, they're more focused, depending upon the trees available, the fruits, and the greens in some cases. We've pushed these beautiful mountain gorillas so far up that, the selection's getting difficult for these poor things, and, it's just the way we are here, push everybody else off. But someone asked me about moles. That's one of the questions that I have on my questionnaire. Do you have moles growing on your body? And that's part of the fungal family. You'll see moles on an individual that has adrenal gland weakness, and they're having sugar metabolism problems. So, sweetheart, you're having sugar metabolism problems. That's your adrenal glands. and your body can't do starch. I mean, anything fermented is just going to feed these guys. And now that you got them on you, I would take Parasite MNG or something equivalent there for extended period of time until they start falling off, because they'll start falling off if you go on a parasitic formula. But I would also, of course, avoid the starches and really work on my adrenal glands. It's that simple. They're they'll grow all over you, like you're saying here, and that's common. Watch your blood sugar, because you're probably going to have a tendency to run low blood sugar, but as you get older, it could go to type 2 or higher, hyperglycemia, in other words. And then that's just the adrenal glands. So, but there's a lot of other things that come into play here, and so you want to kind of be aware of that. But I'm amazed at the people that don't know that. I mean, interesting. And another question here, Mike, is herpes and shingles. And of course, shingles is just herpes attacking the myelin sheaths. Again, back to these vaccinations and back to the smallpox vaccination, which mutated into the herpes virus. Also, there's a great book called The Emerging Virus. I think that was Wallach, or I can't remember his name, but that's a good book on HIV and Ebola and things like this. We have such a, I don't know what, man, just, it's an interesting level. So I can say this, that a lot of people have went on raw foods and have tried to detoxify themselves, and with very little luck. And I can tell you that's why I like the herbs. I mean, I keep coming back to that, but I'll tell you something. Without our little sweethearts, that's we're going to be suffering, because the foods just don't have the power and the punch. Like someone was saying, the fear of hybriding these all these fruits and things, and that is a warranted fear. Anytime you hybrid, you keep weakening the strain, and of course this is why Monsanto is going crazy with trying to stop the onslaught of parasitic invasion of the weak. Well, you can't. That's nature. We should be strengthening strands in every way we can, just like we're talking about our offspring. It's essential to do that, and we have to break that. That concept that we can attack things and that we can weaken things, but then keep nature from attacking it. That kind of insanity, it's just unawareness, and it just has to change, But I would take an antiparasitic, even though this is a viral. I would still take a parasite, which has antiviral properties, but get deeper into the lymph system and get your kidneys and adrenal glands on, and get yourself filtering better. And dig deeper. Sometimes it's going to require some of these deeper fasts, and like it or not. But that's kind of the fun of it. When you change this, then that becomes fun, because it's like, I only did 3 days this time. Dang it! And then next time you try 5 or 6. You don't beat yourself up too much. But I kept pushing myself, because sometimes I just, I'm a male and a farm boy, and sometimes I just couldn't do the 5 or 10 days, and then sometimes I could do 20 or 30. So it was just all in, all in the moment type stuff. But keep working on that herpes. We have a lot of people with herpes out there, and don't feel bad about it either. Genital or whatever, simplex. It's just the nature of the human race now. We're very toxic. We're breeding grounds. We offer great culturing mediums for the microbial world, and we weaken ourselves. So we're offered a viral field day, and the viral field day it is great. I don't care about the bacterial day. However, it's getting to that we're so toxic and cells are so weak that it can be a feeding frenzy out there for those guys, and of course that doesn't feel so good on us. Still, we have to go back and consider causative factors. And this shingles, man, it tells you that your myelin sheaths are weak, and that's hands down adrenal gland weakness. In genetic downlines of adrenal weaknesses, you can see it in your iris here. You get rings, like if you cut a tree and you see the age rings. Well, if you look deep in your eyes and get a flashlight, or go to an ophthalmologist and get a real up-close picture of the iris, not the pupil or retina, but the iris, Well, if you look deep in your eyes and get a flashlight or go to an ophthalmologist and get a real up-close picture of the iris, not the pupil or retina, but the iris, you'll see rings in your eyes. And these rings are called nerve rings. And, of course, anything weak's attacked, and that's what the job of a viral is. So you got to strengthen your adrenals, therefore the neurotransmitters come up. It'll in turn strengthen the myelin sheaths. I think it'll also do the new brain and nerve formula, give strength to that nervous system on top of that. At the same time, I'd be opening up that kidney, because with the adrenals comes the kidneys, and of course here's the lymph system. So I would work in that vein there. And while we're going on that vein of moving that lymph system, here was a good one that was written, was what was this? Acoustic neuroma. Let's see who wrote this one, because he's getting Hollywood 103. Hey, Hollywood 103, man. Listen, everything is right-sided on you, and remember why? Because you have bilateral kidneys. You have a kidney and adrenal on each side of the body. One kidney can be weak over another one for sure. You can feel that, which side of your body stiffer, which side you're growing cysts or moles or tumors on. I think there was another one that was asking me about pus and always producing pus. Well, you're not always, you're producing acids at the cellular level. Your mucosa and your lymph system is that fluid of protection. So sometimes that fluid, is dealing with so much necrotic and acids and all the trash that it's coming out, especially if you're a milk drinker or a dairy consumer and you're just putting this stuff in you. Drinking milk is drinking pus. Now, that might not sound too good to you, but drinking milk, eating cheese, eating ice cream is eating pus. And I'm telling you, those that have the acnes and rosaceas and all this, it just makes it worse. Now, so you've got to open up this can. You hit it right on the head. You've got the kidney, the adrenals. You've got to move that lymph and break down these tumors. It's benign now, but this is right back here in the 8th cranial area. You're going to see some equilibrium. You're going to see, some issues here, and you want to get that out of there, because that's still pressure, that's still acid, and you can still get, and that's also showing you what's going on locally. That isn't just an isolated benign tumor. It reflects a fluid that's head to toe in you. So that you hit it right on the head. That's what you got to get going. And a lot of times, and you also found this out, that a lot of times you don't know that you have tumors in you. A lot of people don't know that they're full of tumors. So I think getting into health should be a fun thing, and you don't worry about the small stuff, because you don't want anybody to start messing in here. You want to get that out and fix the causative factors, and you don't grow another one and it won't get bigger. And it can hyperstimulate nerve growth as well. So that was a real important question. I appreciate the question, and I appreciate the observation, because you're exactly right. You hit it right on the head. Now get in there and really, really dig out and get into those higher grape fasts or something. You'll be okay. I get that. I do 2 lymphatic formulas, 2 kidney formulas, and really move that open, pop up my adrenal glands, of course. I'll get that RA up there. I asked him about that. Again, we're running a little bit behind. Well, he is. I guess I am too a little bit. But yeah, Mike. So go on with that. The moles, good. We took care of that. People have asked me about the celiac disease. Bottom line, and I love this word. I think Webster's dictionary should put this in their dictionary: interstitial lymphatic constipation. Don't you? That's interstitial. That's where your problem is. That means around the cells. That's that interstitial fluid. If it's in the small bowel, if it's in the colon, in the small bowel, you're going to get malabsorption. No question about it. You're going to break down the villi in time. This is all part of the whole thing. But it can be in the lungs. It starts to be head to toe. And if you have this, it's moving to the liver, the pancreas, because this is the fluid that's systemic, meaning head to toe. So, I was wanting to finish that. See, I kind of get off point sometimes thinking here, but digestion of our foods. This ties me right into the second thing you've got to do is absorption. You don't absorb your nutrition you're done. If you don't digest your food, you're done. That's like having a Kentucky Derby. Your horses are all lined up, the gates open, your horse takes off and falls right there. That's the beginning of the race. So really, you got to. That's why we work on the pancreas and the liver. Get that lymph, because this is the lymphatic issue, and then get that moving. Of course, what's the third thing? And this is what other naturopaths need to understand. The third thing is, just because you put calcium in the body, because you put iodine, because you put magnesium in there, doesn't mean your body's going to utilize it. Why? That's right. Your adrenal gland steroids are responsible for the bulk of utilization of nutrients. Remember, the parathyroid hormone, parathormones, responsible for calcium utilization. So if you don't have these steroids and hormones up to par, you're not going to utilize. Well, then we try to give them to you. I did that way back then. I thought we were beyond that kind of thinking. And so a lot of people pay a lot of money for supplements, and God forsake you start doing intravenous work with mega doses of supplements. I mean, what we're seeing with ascorbic acid treatments intravenous is hardening of the arteries, because from what we know, ascorbic acid is antagonistic to calcium. Not smart. What are we trying to do here? You know, when you're trying to treat like this, you know, it ignores the principles of true naturopathy. You know, the foods and the detoxifications and the cells and the fluids and the two sides of chemistry and all this. This is a modern naturopathy. I'm kind of ashamed of it, to be honest with you. I know people want to become naturopaths out there because it's such a beautiful word, but it's naturopathy, and there's no such a thing as naturopathic medicine. These two are two separate thoughts. They don't gel. It's like German iridology and American iridology. Dr. Jensen found that German iridology had some fallacies to it, and one of them was that the eye patterns and colors are at birth and don't change. So unfortunately, is it Ellen that took Doc's stuff now is saying Doc had it wrong? Am I hearing that right, Ellen? I hope you're not, because that would be an insult to the great man. If you have a different opinion, say it differently on the side. Don't cut the old guy. I was a close friend, and I know a lot of things I could say here. But the problem is that eyes do change. I have a ton of befores and afters of this. Amazing. And if you can't get the eyes changed and you're a practitioner, you better learn what we do here, because you're not getting deep into those interstitial areas and changing them. And if you read the premise of iridology, you'll find that it's based upon the now. I get a little passionate, don't I? Forgive me about that. Some things go on I don't real happy about, and I think it shouldn't be done. Sorry this guy gave you a cocktail and all that, honey. Get yourself balanced out. Or is this a man here? Let me see here. I didn't see the name, but get yourself balanced out. Get yourself on fruits and vegetables. Get yourself down that detoxification road, because that's what you need to do here. Let me see what's going on here. He's been losing hair and nails. I mean, you're ridged. That means you're very acidic, your lymph system. And what are you going to do when your lymph system's backed up, you have high acidosis, and you're hitting that with vitamins and minerals? You wouldn't have been alive 4 minutes after doing that. So, no, that's not happening. When we have stomach cancers or peptic ulcers, someone asked me about, or any ulcerations where acids are chewing down the cells, and of course you're not going to detoxify well on proteins anyway. We get you off of the complex foods. You notice we take you off of starches, we take you off of fats, and we take you off of protein. We take you off of complex foods. Your body doesn't need to waste the time. These are second-hand foods. These are foods that the body has to work too hard. And knowing today we have compromised pancreatic functions, compromised adrenal glands, and kidney filtrations, the liver and gallbladder people. Notice how many people are asking me about liver and gallbladder. Dan called the other night and asked me, what about the liver and gallbladder? I'm getting a ton of requests about it. Again, the same thing, where our lymph systems are backed up so bad. I can tell you that if you kept it simple, the food we've been eating has been breaking down our eliminative organs. And now our eliminative organs are not eliminating well for us. That simple. And that has backed up a major problem. And in the kidney sense, the body's sewer system, that is major, because that's a system that deals with the corrosive or acid side of chemistry, and that's not a side of chemistry you like. Now, a lot of people do like a big drink of Coke or Pepsi, but that's an acid burn, and when you drink Coke, you're losing a lot of calcium. Just like Coke and meat and all these high phosphorus foods, you're leaching calcium out of yourself. Well, those that have brittle fingernails and they bruise easy and they have spider veins, you're going to get yourself in trouble if you lose too much calcium. You women like that, you get a lot of postpartum depression and things like this. Let me see. When this person goes on fruit, their acne, they talk about acne here, and I know that we got a video coming on that. But, when you go on fruits, you're going on a very powerful food, nutritively and magnetically. And it rocks the body. I mean, for those of you that are working this, and I love you guys, you're seeing the difference. When you start rocking that body with energy and chemistry, it starts rocking. And the thing is that when you have acne, what's not working? Your kidneys. You're not filtering. So your skin is filtering for you. And those are acids. That's why acne is red and doesn't look too good. How about psoriasis? Rosacea. Same stuff. Dandruff. Same stuff. And acids just break you down. Those that have dandruff, just leave it on your head for a week and start to burn the scalp and get sores on the head. Acids. They just break us down, guys, so we got to get them out of there. So what that's telling you is that your kidneys need some work and your adrenals need some work, so you can open that door, and then your skin. Some people that go on our programs, they just jump all over with rashes and acne and things like this because the skin is the only way out. They can't filter. So you could slow down if you wanted to. Slow down on that detox of yours. Don't go so radical. And that'll help you. Go slower, and then but hit the kidneys and the lymph and all that with the herbs at the same time, and go slower with the diet. Have maybe 1 fruit meal a day and 2 vegetable meals, and go slower, and then it'll be easier on your skin. If not, head on. But to make it more comfortable for yourself, you might want to slow up a bit. And this is aggressive. I don't know where those healers out there or those people that call themselves healers think fruits are no good. You guys are seeing the difference. Yes, we have inferior fruits. Yes. We have inferior everything. So, it's all God. I mean, you've got to bring your own power to the table. You've got to bring the power of God through your consciousness to the table. That's the ultimate healing power. That's why you great spiritual ones out there, you're going to have a great healing and experience. Like someone asked me here to talk to them about OBEs, out-of-body experiences. We'll have fun with that. I got to get through a lot of this, and then we'll have fun on the spiritual side here. Trust me. If you're having allergy reactions, this is another thing. Baby and Earl. Cute. You guys got some cute names. You can go slow with this. You all don't have to go fast. I'm just one of those guys that plows the field. Our clinic is, of course, a health clinic. And you're going to be noticing that we're converting this to a health club, a private health club, and you're all welcome to be members free. We're a health club. We want to change the focus because there's, everybody's always thinking about diseases and treating diseases. We are a health club. We're about health. Our focus is about health. We think diseases are man-made, illusionary concepts of allopathic thinking that have no basis in reality or truth. Because all your body is a bunch of cells, 2 fluids, and there's only 2 sides of chemistry. Sure, you're going to see mutation. Sure, you're going to see tumors and inflammation. Sure, you're going to see different symptoms from that. Okay. Location, location, location. Okay. But the root cause is always the same. And if we keep addressing the symptoms, too many people are getting hurt. People are getting slaughtered. Babies are dying. That's got to stop. Got to stop. You know, the people's about had it, and these things have got to stop. So if you're having an allergic reaction to the herbs, go slow. Go half dosages, quarter dosages. Don't do them and do the diet first. Some people are so bad in their lymph systems and their kidneys that we have to do the diet before we can introduce the herbs. Well, it's okay. Just go slow. We'll work you through that, and then you'll be able to take the herbs, and then you'll be able to go right on down the road as you get better and better and better and better and better. It's okay. I mean, we're all waking up to more reality, and it's like, ooh, where am I on this road, you know? And unfortunately, some people are, you know, down the road a little bit. So, you know, it's okay. You just back up and come on down the right road. That's all it is. You'll be okay. The RA thing here, Dan's coming. I don't know if it's on there yet, but it's coming there to you. I did that, I think, yesterday there. Schizophrenia, I'm going to address that next week. But same thing, in detox, hit all your endocrine glands and get on a ride spiritually. I can tell you that. But get on your adrenals and your thyroid. Hit up the calcium utilization and the adrenals, your neurotransmitters. And as you clean all the brain pathways, clean everything up, you're going to be great. A lot of this isn't as bad as you think. So don't identify with these sort of things. You know, just keep detoxifying the body. But I'll address, because I've had a couple of those questions, I'll address them next week for you and help you out. This is from Germany. But to keep moving with this body, too bad we can't get the herbs to you over there. I think when Germany signed the Codex thing, that was a big insult to the people of Germany, because Germany has always been prided as being a mecca for natural health and for herbs and things. And then they signed the Codex Agreement. I don't know. I don't know what's going on with our people that we elect to help us and oversee and protect us. They're letting the corrupt come in here, so I'm sorry about that. I think I talked, BJ, I don't know if I addressed you here about the Hodgkin. You know, this is another sad story, my friend. You know, Hodgkin's lymphoma at age 5, chemosurgery, and then came back at 16. See, when it came back, it always comes back. You know, there might be a handful of cases that it doesn't, but I call it the residual kick. It's just waiting. So, yes, you're doing good, my friend. You clean your body up, you strengthen your cells, and you'll never have to worry about this again. Get any radiation that you might have had out of there. Get that chemo stuck in tissue out of there. Your body will repair the cells. And you know you had a lymphatic problem back at 5. You know you were born with kidney and adrenal weaknesses. So you're working on some genetics. That's why your diet should be more pure. Dig deeper into that lymph system, and you'll be good. Okay? You're doing good there. Now, you were put on Synthroid. Yeah, you know, sometimes you get off of these things cold turkey and you feel better. I always recommend titration if you're going to do that and substitute a glandular in replace of that. But, you know, you're experiencing a good situation. Some people go cold turkey and they're good. You know, the problem with medical doctors, they put you on these pharmaceuticals and these synthetic steroids and hormones and even natural ones, and then they just leave you like you're going to need it the rest of your life. Excuse me. Yeah, if you're having allergy reactions, this is another thing. Baby and Earl. Cute. You guys got some cute names. Well, you know you can go slow with this. You all don't have to go fast. I'm just one of those guys that plows the field. Our clinic is, of course, a health clinic. And you're going to be noticing that we're converting this to a health club. A private health club, and you're all welcome to be members free. We're a health club. We want to change the focus because there's, you know, everybody's always thinking about diseases and treating diseases. We are a health club. We're about health. Our focus is about health. We think diseases are man-made, illusionary concepts of allopathic thinking that have no basis in reality or truth. Because all your body is a bunch of cells, two fluids, and there's only two sides of chemistry. Sure, you're going to see mutation. Sure, you're going to see tumors and inflammation. Sure, you're going to see different symptoms from that. Okay. Location, location, location. Okay. But the root cause is always the same. And if we keep addressing the symptoms, too many people are getting hurt. People are getting slaughtered. Babies are dying. That's got to stop. Got to stop. You know, the people's about had it. And these things have got to stop. So if you're having an allergic reaction to the herbs, go slow. Go half dosages, quarter dosages. Don't do them and do the diet first. Some people are so bad in their lymph systems and their kidneys that we have to do the diet before we can introduce the herbs. Well, it's okay. Just go slow. We'll work you through that, and then you'll be able to take the herbs, and then you'll be able to go right on down the road as you get better and better and better and better and better. It's okay. I mean, you're all waking up to more reality, and it's like, ooh, where am I on this road, you know? And unfortunately, some people are, you know, down the road a little bit. So, you know, it's okay. You just back up and come on down the right road. That's all it is. You'll be okay. The RA thing here, Dan's coming. I don't know if it's on there yet, but it's coming there to you. I did that, I think, yesterday there. Schizophrenia, I'm going to address that next week. But same thing, and detox, hit all your endocrine glands and get on a ride spiritually. I can tell you that. But get on your adrenals and your thyroid. Hit up the calcium utilization and the adrenals, your neurotransmitters. And as you clean all the brain pathways, clean everything up, you're going to be great. A lot of this isn't as bad as you think. So don't identify with these sort of things. You know, just keep detoxifying the body. But I'll address, because I've had a couple of those questions, I'll address them next week for you and help you out. This is from Germany. But to keep moving with this body, too bad we can't get the herbs to you over there. I think when Germany signed the Codex thing, that was a big insult to the people of Germany. Because Germany has always been prided as being a mecca for natural health and for herbs and things. And then they signed the Codex Agreement. I don't know. I don't know what's going on with our people that we elect to help us and oversee and protect us. They're letting the corrupt come in here, so I'm sorry about that. I think I talked, BJ, I don't know if I addressed you here about the Hodgkin. You know, this is another sad story, my friend. You know, Hodgkin's lymphoma at age 5, chemosurgery, and then came back at 16. See, when it came back, it always comes back. You know, there might be a handful of cases that it doesn't, but I call it the residual kick. It's just waiting. So, yes, you're doing good, my friend. You clean your body up, you strengthen your cells, and you'll never have to worry about this again. Get any radiation that you might have had out of there. Get that chemo stuck in tissue out of there. Your body will repair the cells. And you know you had a lymphatic problem back at 5. You know you were born with kidney and adrenal weaknesses. So you're working on some genetics. That's why your diet should be more pure. Dig deeper into that lymph system and you'll be good. Okay? You're doing good there. Now, you were put on Synthroid. Yeah, you know, sometimes you get off of these things cold turkey and you feel better. I always recommend titration if you're going to do that and substitute a glandular in replace of that. But, you know, you're experiencing a good situation. Some people go cold turkey and they're good. You know, the problem with medical doctors, they put you on these pharmaceuticals and these synthetic steroids and hormones and even natural ones, and then they just leave you like you're going to need it the rest of your life. Excuse me. This isn't true because there's regeneration. But they don't think of that because they don't see that, because the people that come to them are always about the same. However, those people that like you guys get well, you quit going to them. So they don't see that, and giving them some respect, they don't see it. And then when people tell them about it, of course, a lot of them are real closed-minded, so then they freak out. And somehow someone told us that somehow we didn't know what we were talking about. And I find that very insultive, to tell you the truth, but you know what? I've lived with that. I've been called about every name there is in the book. But, you know, it doesn't matter. I'm a God man, and I don't care what you call me. We still out-heal most people on the planet. It's fantastic to see the great souls that have come through a lot of the misery here, and makes my heart well. Yeah, the avocado, we covered that, the stomach acid. Evolution, yes, 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 yes. Yeah, we'll get into that. Yeah, here's one. They get an incredible name for that one. Let me think about that one. I'm an old country boy, so forgive me. But this involves chronic boils, itching, and my body produces a lot of pus. What do you guys think? Whoever wrote that, why don't you guys take care of this one for me? Because most of you, from what I see, are getting real savvy. Pretty soon, you guys can answer these for me because you guys are getting really good. I don't know how to say this to your website, but appreciate it. C-Schrobe. Let's see, does fruits include things like, tomatoes, avocados, cucumber, pepper? Yeah, they really do. I mean, if you were really going to, cover that, you could call yourself a fruitarian and have a lot of greens, like cucumbers and tomatoes and peppers and things like this. Absolutely. If you notice the grasses and the like the romaines and stuff, if you're sitting there just chewing on them, they're not real pleasurable, and they just have a lot of cellulose. As you get into something with flavor, man's more appealed to it. I can tell you, you can take a room full of young people, say from age 6 or 7 up to age 12, before too much conditioning comes in there, and have a big table of food. Well, over here you have a big platter of vegetables, and over here you have a big platter of fruit. And you just let, 20 kids come in a room. I can tell you which platter's going to be gone first, and it won't be the vegetables. Let me see here. This lady is 36, breastfeeding a 2-year-old that hasn't quit being weaned. I would. It's time. And I would do fresh juices, probably cut fresh grape with fresh apple, because fresh grape's real powerful. And, start playing with some coconut milks maybe with that, and start moving that out. Now, you have Hashimoto's. I mean, she has a thyroid problem. And so, again, not to be insultive to anyone out there, but if you take what's called an autoimmune condition and you bury it in the ground, you'll be better off, because there's no such thing. There's no such thing as autoimmune problems. If a medical doctor says you have an autoimmune problem, that means he hasn't got a clue what's causing this. It's that simple. There's no such thing. Everything has a causative factor within chemistry and within the two fluids and within the cells. There's no such thing as autoimmune problems. If a medical doctor says you have an autoimmune problem, that means he hasn't got a clue what's causing this. It's that simple. There's no such thing. Everything has a causative factor within chemistry and within the two fluids and within the cells. There's no such thing as your body doing something for nothing. That means everybody's body's doing what God didn't want them to do, and they're all having autoimmune problems. This stuff is idiotic. It's almost like, okay, next. So, really, what's going on here? You have a weakness in these tissues. So you want to now, after you get her weaned, you can take off on yourself and detoxify yourself more aggressively. But she's going to have a bit of a thyroid herself. And you also know that she's going to have some kidney and adrenals big time. So what you're going to do is, by putting her on these fruits and fresh fruits and stuff, and coconut milks and stuff, you're going to super enhance her brain and nerve system. You're going to really build some good, strong muscles, and it won't be fat. And you're really going to have a great child there. We have a lot of children raised on raw, and it's just phenomenal. I've had to get even 1-year-olds away from milk because of the cancers and stuff, and put them on a healthy diet, to get the health back into the tissues there. And so, again, when you wean her off, you can do glandulars and stuff like this. You've been on Synthroid for 12 years. You're up there pretty high dosage. I have to look at your case, see what's more to it, because remember the pituitary controls the thyroid and parathyroid. I would have to look at that. Watch yourself for postpartum depression. That would also mean there's a parathyroid there. That's calcium utilization, and your little baby takes a lot of your calcium out. So really watch that. Watch calcium-related problems like brittle or ridged fingernails and spider veins and stuff like this. I'll tell you, if you see parathyroid and thyroid weakness together, the suspicion should really start to ring toward the pituitary. If you have ovarian problems where you're having your menses is irregular, or you're having anything ovarian, you can't conceive, or the opposite, you don't have hardly any, that's hands down the pituitary. So if you correlate other endocrine gland problems, except for the adrenals, I'll tell you flat out, I think everybody's adrenals are weak, period, individually, separate from the pituitary. But when you have a pituitary weakness sitting on top of that, I think it can exacerbate the adrenal weakness, to tell you the truth. What's my time doing? I got 10 minutes. And then everybody's going to run out on me. Let's see. Yeah, I mean, that's what you got to do. Keep working on that. Use a cytotrophin for your thyroid, but if you look at a little more information here, you might find a pituitary. You can use pituitary cytotrophins, but how do you turn on cells? Well, raw foods, obviously. That magnetically a raw food. And we talked about the magnetics. You could use the word angstroms, I suppose, but a vegetable has 9,000 angstroms, basically, or units of energy, or vibrational happy faces, and fruits have 12,000. I mean, for the sake of magnetics and intelligence, fruits are much more intelligent than vegetables. I mean, if you go to quantum physics and you went into magnetic energy and you said, well, energy is intelligence, which is what we've proven, then those with more energy have more intelligence, maybe. I don't know. So when you look at those differences, and you look at the type of animals that eat those differences, I don't see how anyone can say vegetables are superior for man. I don't see where that comes from. In any way, shape, or form do I see where that's come from. I think it comes from medical thinking, and they're looking into the medical world trying to get some of their information. What? Oh, let's see here. All right, we're getting there. I apologize. I rattle on, but I hope that I can cover all these things. You hear a lot about the B12 deficiency and all that. That's the adrenal glands. Cobalt and all that. That's the adrenal glands. Let me see what else we're going here. Sorry to take up your time here. Yeah, this person's allergic to all nuts and stuff. Good. I prefer you not to have them anyway. I'm not opposed to nuts, but they're very concentrated foods. I can just go in and eat a handful of almonds or pecans easy. I used to suck them down. It's like, ooh. I'm real bad with pignolia or pine nuts. I mean, pine nuts are so good. Much more of a fatty nut, like a coconut. I think that would be better for you if you're going to do that. Not so concentrated in the protein side, more in the fat side maybe. So that would be better. But, I did pull people off of proteins, real essential. So you also asked me about ozone therapy. I've tried ozone machines in the past and always got headaches and stuff, and then I've been reading some of the latest research, and it's saying, oh, man had it way too much. I don't mess with life. I just quit doing it. I've tried different machines through the years. I've been on different machines just to see what it was like, and some I didn't do too well on, and others, okay. So I've had a Rife machine, and I'm not after microbes. I'm after the cell. And I'm after the two fluids that make the cell healthy. If bacteria's in there helping me, good. Remember the story I told you about the young man on Ripley's Believe It or Not who had a lymphoma. He ended up in northern Alaska with an Eskimo elder that put him on rotten food. And all the rotten meat and stuff he ate, and 3 months later he had no lymphoma left. All this Eskimo elder said, man, your sewer system's backed up. I'm just going to give you a lot of little probiotics, but the right kind. Let me see here. Yeah, interstitial cystitis. Interstitial, where is that? Around the cells, right? And itis, what is that? Use itis, and if you say acids, their word is inflammation, but if you say what causes inflammation, inflammation is an immune response. To what? So go to the acids and proteins, and you will find mostly what inflammation is about. And again, you're not really moving your lymph even in the wall of the kidney and bladder. So then you'll see a breakdown or cysts or tumors growing on the bladder or kidneys. Again, really get into those adrenals, really get those kidneys and bladders filtering. Pee in a jar. Get a jar and pee in it. When you see a lot of snow and mucus in your urine, I had a urinalysis a couple days ago that had on it mucus strands. I've never in 40 years seen a urinalysis where the lab actually wrote mucus strands. Oh, that was pretty good. You want to see a lot of mucus strands. Be a good thing. Okay. Yeah, honey, when you have a lot of inflammation in the body like that, you might stay easy off the acid fruits. You know, you might stay easy off of them and go to the subacid fruits. That might do you better with this cystitis. And just keep working on your lymph. We have a Hillel tea, good tea to drink. Soothes the mucosa and stuff. Has a little drawing power. Plantain. You know, if you ever get snake bit, spider bit, use plantain. Any of the lymphatic formulas, if you're out and you get snake bit, carry a lymphatic formula with you and you won't have to worry about snake venom. But just suck down the lymphatic herbs. That's all for neurotoxins, excitotoxins, stuff like this. Plantain just happens to grow everywhere, and I love it. It's in our bowel formulas. I put it in our Hillel tea. So it's a drawing for acids and things like this and toxins, you know. But it has some slippery elm and marshmallow, which is real soothing to the mucosa, anti-inflammatory, of course. And acid has some drawing power to it. So I like those herbs, you know, real gentle on the body and on the urinary tract, too. So that might help you, sweetheart. Make yourself a tea of that or get some marshmallow or slippery elm tea. Cool that down. But remember, interstitial is in the wall, and that's lymph drainage. The kidney formulas should help you well with that. And get on those adrenal glands, too, there, dear one. Yeah, most mom and dad developed diabetes. Wow. And they passed in 45 and 50. I think more people pass from the treatment of things as opposed to things, because I can't imagine anybody passing from diabetes. It's the easiest thing on the planet to cure almost, except when you're type 1, you're brittle, or maybe it's a neurological and you're really working on some real neurological weaknesses from birth with the adrenals and maybe the CNS. Yeah, I mean, it takes work sometimes, but to pass from stuff like that just freaks me out. It's like dying from pneumonia. I get in here triple pneumonia. Nobody dies in here from pneumonia. I remember once I was on the cardiac floor, and I was looking at some heart monitors and looking over this room, and here's this RN trying to give this man a milkshake and an LPN suction him. The guy was rocking with so much mucus, and the LPN was trying to suction him, and the RN was saying, Mr. Jim, you've got to drink your milkshake. I almost hollered, well, you're going to kill him. I mean, oh my God. I mean, this is insane stupidity, especially now. This is the 21st century. So, sorry to hear about all that stuff. you get plenty of amino acids. If you think of protein as amino acids, I would lose autoimmune. I would lose protein in my thinking. I would lose some of these things like that. You know, I'm going to have to finish this up. And I'm almost done, but I'm going to have to finish this up real quick. The same lady here, she asked me about vinegar and baking soda and lemon juice for veggie wash. I like hydrogen peroxide. I don't think vinegar's good. I don't know. I like hydrogen peroxide, but maybe. A lot of people use soaps and bleach. Oh no, that's not good. But anyway, thank you all. You are great people, great souls. I really enjoy talking to you and working with you. I love your feedback. You all have fun this weekend and be in the now. You know, just take all weekend and practice in the now. If you want to take a trip out of body, go somewhere. Put yourself somewhere. Lay this body down in ultimate peace. Lay it down and just totally relax and picture yourself somewhere else. Put yourself somewhere you love, somewhere you enjoy, and be there. Be there as much as there as you can until you pop out and you're there. And that's just what it takes, even if you start looking down at yourself from the ceiling. But you have to relax your physical body and realize you're separate than that body. You're just stuck in here because of your attention. And some people have fear to get away from it. It's like, well, so have fun, have some OBEs, and have a lot of fruit. All righty, and berries too. And I'll have a lot of watermelon with it. All right, we'll see you later. Bye-bye now.